out of all the people that I've had the pleasure of speaking to, you seem to be the diaphragm expert. So I'm really excited to dig in. So maybe would you just start by sharing a little bit about your credentials and background so people know a bit about who you are, what you've done, and what gives you some authority to talk on this case of diaphragms?
Okay. Okay. Well, I'm an osteopathic physician living in Ithaca, New York. I have trained extensively in traditional hatha yoga, meditation, martial arts. I've been extraordinarily blessed to work with many great and brilliant teachers, people who cultivated in me my people who help me to cultivate my reverence for nature and my lifelong obsession with the breath. But probably the thing that really kind of got me into all of this so deeply was because when I was very small, about 5, 6, 7 years old, I I was afraid for my life. I was so ticklish. It was painfully ticklish. And a lot of people like, not a lot, but there were people in my life who found this very entertaining. And I know they didn't mean any harm. Like they probably had no idea what I was going through as they were tickling me. They had no idea that I was having this insane, sharp, splitting, cinching, spastic pain in my lumbar spine and across my back. And, but, that they didn't mean any harm didn't make it any less stressful and anxiety producing and terrifying, really, because that was combined with a total loss of breath. Like when I would get tickled like that, it was like somebody hitting me in the solar plexus. Like I had the wind knocked out of me, and I would feel like I was trying to suck in a long overdue inhalation through one of those little straws they use to stir coffee. So it was really uncomfortable. And one day I just knew it. I had to control my breath. I had to. And so I knew I had to make it slow. I knew I had to make it deliberate. I knew I had to make it really smooth. And when I did, I became immune to tickling. Immune to this very day, in fact. And the people, my tormentors, they lost interest, and I was saved. But I was also very impressed. I was very impressed by this little superpower, because after that I went on to, like, I stubbed my toe. I remember not long after that I stubbed my toe really hard. Most people, when they feel pain, what do? They go, they inhale and hold their breath. And my reaction to it was to forcefully do a forceful, prolonged exhale. And I thought, and it just made it not hurt. And then shortly, in the next, like, probably year or so, I realized I could use it to regain my balance. I could use it to reinforce my strength. And it really felt like I had a secret little superpower. Little superpower, but it felt like a little superpower to me. So I paid a lot of attention to it as I went through school and did my pre-medical and my medical studies, as I was introduced to traditional hatha yoga, meditation, and martial arts practices, as I would climb walls and navigate the white water and deep pools and river gorges, or even as I was teaching and writing poetry. Most definitely as I became obsessed with and addicted to Brazilian Jiu-Jitsu. And then, probably one of the biggest influences has been as I work with patients as a physician. Most of my patients have severe chronic illness, things like autoimmune disease, chronic Lyme, long COVID, even things like heart failure, even things like chronic venous stasis, lymphedema, all manner of chronic fatigue pictures, right? Um, and and then all of the patients I've seen, literally all of them, have suffered from a profound underutilization of the thoracic diaphragm. So, but I learned a lot in this process, and probably one of my best teachers, one of my most valuable assets in all of this has been my own dysfunctional breathing patterns. That most of them, most of them, I would say, are results of I was born with them, like most people, almost everybody, and I acquired, like in the regular calamities of childhood, both regular and irregular calamities of childhood, acquired dysfunctional breathing. And some of it I'm still unwinding to this day, but it has been incredibly edifying for me to go through the process of having dysfunctional breathing and learning so much about the glory of the breathing apparatus. And you know what I'll say? Probably like most people who become enamored with the breath, I have, most of us have something in nature that grabs our attention and, causes us to realize that the thing that is the thing that most people take completely for granted, the thing that is our most essential common denominator that everybody has, that thing is the most glorious, the most mesmerizing mystery, the thing that is the most worthy of our reverent and steady attention. It is just beautiful. So I appreciate the beauty. I think that makes me qualified.
Love it. But just break a couple of those bits down. You say thoracic diaphragm. Just break down for the audience the word thoracic. What does that mean, and what's a thoracic diaphragm?
Well, if I may,
Please.
my little, I actually carry this around with me almost everywhere I go. If I have.
Just explain for the audience listening as well what you've got there. If that's okay.
I'm holding up a picture right now. One of my favorite pictures of the thoracic diaphragm. This is Netter's version. And the picture I'm holding up is a picture that it's the view you would see if you were looking up at the thoracic diaphragm from the bladder. If you were standing on the bladder looking up, that's what you'd see. Now, it is a diaphragm. That means it is a sheet attached to a frame. Any sheet attached to a frame is a diaphragm. Is the glare okay on there? Can you see it? Okay, great. All right. So your thoracic diaphragm is a sheet of, and like I said, a diaphragm is a type of structure, right? It is a sheet attached to a frame. Your thoracic diaphragm is a sheet of muscle and connective tissue that's attached to the bottom of your sternum. Follow along with me here. Put your finger on your sternum, and then you're going to trace around the bottom of your rib cage. This is the bottom of the rib cage. And then it attaches here to the tip of the 12th rib. You're going to find that just on the back side at the bottom of the rib cage. You might not be able to feel it. If you can, it'll feel like the rib comes to an end, and you can push on the end of it. Could you see that okay, what I was pointing to? Because I was feeling from my own 12th rib. And then there's a little bridge from the tip of the 12th rib to the tip of the transverse process of L1. L1 is that little spike on the side of your vertebra that sticks off to the side. And then there's another bridge from there to the front of the lumbar spine. And yet another bridge from one side of the lumbar spine to the other side of the lumbar spine. So there's 5 bridges. And those little bridges or overpasses allow for 5 structures: the aorta and the quadratus and psoas on both sides to pass behind the diaphragm and be in both the chest and the abdomen at the same time. Now these fibers that come all the way down to L4 come up because the diaphragm is attached to all of the lumbar segments. Let me let you know where that is. If you put your finger on your navel and trace around, you will touch the top of your hip. And if you keep going around, you will get to the fourth lumbar vertebra. So your diaphragm is attached to all of those lumbar vertebrae except L5, right? So important, so important. And then the fibers that come down to L4, you can see they come up and they make this little loop of muscle that's just in front of the aorta and just behind or posterior to the central tendon. Now, this little loop is where your esophagus comes through your diaphragm and becomes your stomach, right? So your mouth, your throat, your esophagus, your stomach, and all the intestines and colon, they are all the same tube. This is where the tube, this little loop in the top of, kind of almost at the dome, the top of the diaphragm, this little loop is where your esophagus comes through and becomes your stomach. This actually is your lower esophageal sphincter. This is what tightens up and keeps food from coming back up after you've eaten it. This is the central tendon. It's made of connective tissue. This hole in the central tendon, and the central tendon, I'll describe it for you, and this will become more clear for those of you who are just listening. The diaphragm is like a dome, and it has a strip of connective tissue at the top of the dome, and that strip of connective tissue is attached to all those borders that we described via muscle. So the central tendon is connective tissue, and then all of the pink stuff around the central tendon is muscle. So your diaphragm is made mostly of muscle. And that means it can do what muscles can do. Muscles can contract and muscles can relax. For those of you who remember your high school biology class, your muscles have little strands, little fibers that slide past each other. And that's what happens when muscles contract. And when muscles relax, they slide past each other in the other direction and elongate. So muscles can contract and muscles can relax or elongate. Your thoracic diaphragm, when it's relaxed, do I need to describe my little, yes, I will, okay. So let me narrate my little, interpretive dance here. So what I'm doing right now is I'm holding my fingers touching each other and making a little dome with my forearms parallel to each other in front of me, right? So that's kind of the shape of your thoracic diaphragm. It's shaped like a dome or a parachute. And when it contracts, the muscle fibers will slide past each other, so the diaphragm will flatten. As a dome, if you imagine if a parachute was made out of muscle fibers, when it contracted, the dome of the parachute would flatten and it would become shaped more like a drum head rather than a parachute. And that flattening of the diaphragm is going to push down, it's going to smush the contents of your abdomen. And as a result, the belly will appear to grow larger in volume as the belly squishes outward like an exercise ball will squish when you sit on it. But it's not really changing in volume, it's really just changing shape. What actually gets larger when you flatten the diaphragm is the volume of the chest cavity. When you enlarge the volume of the chest cavity, you are going to decrease the pressure in the chest. And that decreased pressure is a vacuum. And that vacuum is what sucks air in from the external environment. We call that inhalation. Now, let's go back to that flattened diaphragm again. When I relax the diaphragm, it's going to dome back up like a parachute opening. And just like a parachute opening, that creates a vortex underneath your diaphragm. I hope that that realizing that you have the power to create a vortex in your thoracic diaphragm gives everybody out there a little tickle. What an awesome power to have, the power to generate a vortex. Sorry, I get excited. So I'm going to relax the diaphragm, and that creates a vortex underneath it. And that causes the organs to lift up underneath the diaphragm, so they will then again occupy space behind the rib cage. And that makes the belly appear to get smaller. But what actually gets smaller is the volume of the chest cavity. So that will decrease the volume of the chest cavity, that increases the pressure, and that causes air to go out. It actually causes the air to get sucked out of your chest by the relative negative pressure of the external environment. So your diaphragm is a pump that's moving air into and out of your chest cavity from the external environment. Now, did I answer that question? Can I go on for a little bit here?
Yeah, I'd love to ask you a couple of quick questions, or am I ruining your flow? Do you want to keep going and I'll save the questions?
Well, no, go ahead.
Okay, so somebody was telling me the other day that the diaphragm is made of smooth muscle tissue, and therefore, because of that being the case, you cannot make it stronger like a bicep. Can you just share with me your thoughts on this? Because I hadn't heard that before.
I don't believe that's the diaphragm is made of skeletal muscle. That
Okay.
is part of the glory of this, is that the diaphragm is actually a skeletal muscle, and we do have it. It is very readily amenable to our conscious control because it is a skeletal muscle, just like your biceps or your
Okay.
quadriceps or your eyelids. You know, it has a lot. It gets a lot of autonomic input. Right? It responds to things without us having to think about it, just like blinking. So there's a lot of autonomic input, but it's
Yep.
actually skeletal muscle.
Interesting. So does that mean that the diaphragm has the ability to fatigue and atrophy, but also to grow?
Um, you know, I would say yes to all of those things. And I think it doesn't generally fatigue in the, that like in the same way, like to this, I mean, it ultimately will fatigue, but I think what people run into before they have fatigue, or sometimes the things go together, is that people become so congested, lymphatically congested, above the diaphragm, below the diaphragm, and actually within the central tendon itself, because there are little lymphatic channels within the central tendon that actually drain the lymphatic fluid out of um, the mostly out of the liver. Most of the liver, the front and the top of the liver, drains its lymphatic fluid directly through the central tendon as it returns to circulation. It might be useful for me to fill in a little more information because we could return to that question too. That's a really great question, because and if you wouldn't mind remembering, because it actually really is something that I've wanted to get to talk more about, because you are always asking about stiffness and tightness in the body, and this is really I think the secret to
Yeah.
improved mobility and flexibility,
Yeah,
among
let's go
other
down
things.
there. No, no. The only other thing that I just want to ask is, so if you were to look at an 80-year-old diaphragm and an 18-year-old diaphragm, like based on the smooth muscle tissue approach, they would be, I imagine, quite similar. But I know there's a big longevity expert in your country called Brian Johnson, and he says he's 47 and he has the diaphragm of an 18-year-old. So I don't know how they're measuring that, but it says to me that our diaphragm has the ability to repair and get stronger. Or if we are shallow breathing and not moving much, maybe the diaphragm can get weaker, but that's an assumption. So I don't know if you could talk to
Yes,
that a
it
little
not
bit.
only gets weaker, it has a harder time moving when there's congestion in, above, and below it. It's just
Hmm.
everything congested with lymph is going to be stiff.
Okay.
So it's such an important question because it has to do with not just the diaphragm, but stiffness over the entire body. Um, so, and it actually brings me to this very important piece that with regard to the diaphragm, like we said, it's a pump moving air in and out of the chest, but it's also a pump that's moving fluid into and out of the chest cavity from your internal environment. So blood that's in your veins, lymphatic fluid, even sinus drainage, all of those things are drawn towards the chest cavity every time you inhale. And the diaphragm is actually affecting cerebrospinal fluid as well, but it has a different effect on it. So we'll put that off to the side for right now. But blood in the veins, lymphatic fluid, and even sinus drainage are drawn towards your chest cavity every time you inhale. And every time you exhale, the increased pressure in your chest squeezes the heart and contributes significantly to your cardiac output. And there's actually more to the mechanical splendor of this thing that is in everybody. But for now, it's enough just to realize, it's enough information for us to realize that your diaphragm has a circulatory function. And in fact, your diaphragm is the primary driver of circulation in the body, far outstripping your heart's contribution. And this is surprising to most people, to most physicians, actually, when I first explain it. But then they readily agree that, yes, in fact, it's true, because we know that the heart really only contributes to cardiac output. It doesn't participate at all in fluid return. If we're talking about circulation, we want to talk about fluid return as well as cardiac output. Your thoracic diaphragm controls all the fluid return and contributes significantly. And I would argue, or I at least hypothesize, because I don't have the external proof, that it actually contributes dominantly to cardiac output as well. And this is like the best news that we could have in the modern world, because better fluid motion is better physiology. And like we said a few minutes ago, your diaphragm is a skeletal muscle. So it's very readily available, amenable to your conscious control. You can just make a choice and have a profound impact on your physiology, because better fluid motion is better physiology. May I unpack that a little bit? So in order to do so, I need to talk about lymph. You know, most of us are very familiar with blood. Not most of us, you know, we know what the blood does, where it is, where it's going, you know, that it has this role in, you know, carrying oxygen and carbon dioxide. People don't really have so much of an understanding of lymph. Now, lymph is the clear fluid in the spaces between your cells. It's the extracellular fluid. It's what you would see if you like got a road rash and you skin your knee or your elbow or something, and some clear fluid is coming out of that. That is that's your lymph. Now, from one perspective, we could say that this lymph arises from the blood, because as the blood leaves the heart carrying oxygen out to your tissues, it goes through smaller and smaller vessels and eventually finds its way into the microscopic capillary bed, the tiny vessels that are a bridge between your arteries and your veins. Now, they are so small and thin-walled that they are semi-permeable. That means they act like a sieve, or a strainer. And they'll keep the large things like red blood cells inside the vessels. But little things like carbon dioxide and oxygen, that's just a single molecule. Each of those is just a single molecule with just 2 or 3 atoms in them. And those little things can slip through the walls of the capillary, and that's how we do gas exchange, right? Simultaneously, um, the plasma, which is mostly water, H2O, also very tiny, just one molecule with 3 atoms in it. And even the larger molecules like cholesterol, right, is still just one molecule. A red blood cell is a gazillion, or, a lot. It's an enormous, too numerous for me to think about counting, too many molecules for me to count in a red blood cell. So even things like cholesterol can slip right through the walls of the capillary, and when it does, we call it lymph. In my mind, lymph is plasma in the extracellular space, and plasma is lymph in the blood vessels. It's all extracellular fluid. When this fluid slips through the walls, and we call it lymph, this lymph is what brings things to your cells that your cells want and need, the nutrients and fats and proteins. It's the means by which your immune system gets where it needs to go outside of your blood vessels, and most of your body is outside of your blood vessels. Now, this is also the place where cells are going to dump metabolic waste product, like lactic acid, for example, will get dumped into the lymph. So the longer the lymph sits in any given spot in the body, the more it becomes depleted in nutrients. Let's start to say immunocompromised, depleted in nutrients, and concentrated in waste product. The more concentrated it becomes in waste product, the harder it starts to become for cells to get rid of waste product, because the concentration gradient is changing, and the trash can is too full, essentially. So at some point, your cells may actually have to start to use more energy, which is your energy, to get rid of waste. And if they can't keep up, now you're going to have a situation inside your cytoplasm where the high concentration of waste starts pushing backwards on your biochemistry. Think I need to explain that a little further, how that
Yeah,
happens?
unpack it a little bit.
Okay.
And if you can, just for those not medically, afraid with some of this language, like me, just dumb it down a little bit for me. Like, 'cause I'm following along, but yeah, if you could make
Okay.
it just simplify a little bit, that'd be really
Okay.
appreciated.
I will do my best.
Thank you.
So what
Because
I
you've got
what
this, you've got so much good information here. I just want to make sure that people can really absorb the wonderful stuff you're sharing with us.
Well, I appreciate that so much. And please understand that this is actually my favorite thing to talk about. And it is not hard to get me to talk about it at all. So if anybody has any questions, don't hesitate to let me know,
Very
because
kind.
I may well learn something amazing from you in the process.
Mhm.
So I'm going to explain a little bit about what a gradient is, because nature likes to go in the downhill direction. If I drop this this little image here, if I drop it, we know it's not going to fly up to the ceiling. We know that it's going to fall to the ground, because it's going from a higher energy state to a lower energy state. If I want to take this image and bring it up to a higher energy state, I have to put energy into the system.
Mhm.
Now, this is true with all kinds of things, in like all kinds of conditions in the world. When you open the door in winter, at least where I live, the heat inside the building goes rushing out into the cold air outside, the higher energy state to the lower energy state. And the same is true with, like, if the ball's on a hill, it's going to roll down the hill, right? The same is true with concentration. If you drop a little salt in water, it doesn't stay in one spot. It actually will disperse and go to the lowest concentration possible, all by itself. You don't have to do anything to make that happen. However, if you want to go from the low to the high, I'm going to have to whip out my Bunsen burner, and I'm going to have to, or, like a little flame, and I'm going to have to cook off that fluid. I'm going to have to make that fluid evaporate in order to reconcentrate that salt. So I have to put energy into it, right? So in your tissues, if you start to develop a higher and this is true with biochemical reactions, any reactions, honestly, biochemical or not, the more products you have sitting around, the less likely that the reaction is going to proceed forward without energetic input. Does all that make sense? Right? So we want to create the conditions most auspicious for the forward motion of our reactions of life, right? Because if we let a high concentration of waste sit in the tissues, it's going to slow down your metabolism, it's going to slow down cell repair, it's going to slow down virtually every reaction you need to perform in order to thrive. And nobody needs that. So it's very important to clear waste product from the tissues. And the main thing that does that is your thoracic diaphragm. Is there anything else I want to say about that? Yes, I'll say this. Everything congested with lymph is going to be stiff, like a plant stem is stiff when it's full of fluid. It will probably be painful or at least tender. Some type of neuromuscular compromise sometimes, like numbness or weakness. And it will always lack the kind of vitality, immune function, functional strength, autonomic regulation, and structural integrity, and a whole bunch of other things that it could have if it were not congested.
Hmm.
So
Let's dig into that. Okay. Before we go any further, because I really want, because I'm very stiff. You know, I've talked to you many times about my stiffness. So let's dig into that. Before we do, I would love to just get your thoughts on heart health and poor diaphragmatic movement, and what, if any, pressure is put onto our hearts if our diaphragms aren't working properly. Could you just unpack that a little bit for us?
Oh, happily, I would. Which makes me want to show you one of my wonderful little pictures. Yeah, let me just pull up this picture
Mm,
here. So what I'm pulling up is a picture of the, okay, there we go. So can you see my screen?
yes.
Okay, and let me, why is this? Can I close that? Yes, I could. Okay, great. So what I'm showing you, so your heart, like many of your organs in your body, is in a bag called the
Okay.
pericardium.
Mhm.
So here's a picture of, so what I have on the screen right now is a picture of the heart sitting above the diaphragm in a little white bag. There's a little white bag wrapped around the heart. And now let me show you another picture of, so this is a picture of that same view, but
Mhm.
it shows the little white bag cut away
Mm.
from in front of the heart. So now you can actually see the heart. It's still inside a bag though, right? So it's in a bag inside a bag. So they cut away the outer bag,
Mhm.
and now you see this little line, that's the outer bag, and now you see the heart inside the bag, inside of the bag. So let me explain what happens there for a second. When you were developing in the womb, your organs butted off near your spine, and then they migrated. And as they migrated, they moved into, there were these bubbles of fascia or bags of fascia. And let me, that the organs migrated into. Hold on, I'll stop sharing for a second as I explain this. Oh, can you see me?
Yes, I can see you. Yep.
Okay, all right. So what happened is the organs butted off near your spine, and then they migrated to their ultimate home, right? You know, something like the testes starts off near your kidneys, and it travels all the way down and out into the scrotum. So it organs often migrate quite a bit during your development before they find their forever home, if you will. There, and as you were developing, there are these bubbles of fascia, bubbles of cells that are fascia, and the organs migrate, some of them or some parts of them migrate into that bag. And when they do, they become wrapped in bags, surrounded by bag. Just like if you were to punch your hand into a balloon, your arm would be wrapped in balloon and then surrounded by balloon, right? So that's how many of your organs, percentage, I don't know. A lot of your organs are wrapped in these bags, right? So your heart is in the pericardium. Your lungs are in the pleural sacs. Many of your abdominal organs are in the peritoneum, but they're not actually inside. They're wrapped in that fascia, surrounded by fascia. So let me show you this picture of the heart now. We saw the outside of the pericardium. We saw what happens when they cut away the outer pericardium, and you can see it here as well. Can you see my screen share?
Yes.
So here it is. This is the next in that sequence, right, of removing the outer wall. Now you can see that you can actually lift the heart up out of this space because it's kind of free to move inside of the pericardium, right? And there's pericardium that's wrapped around the heart, right? There's the one that's around the organ, and then there's the bag that's around the outside of the organ. And you can see that the heart is free to move, except that it is tethered to the back wall of the body by these great vessels here, by your aorta and your pulmonary arteries and the pulmonary vessels. And now this shows a picture. This next in the sequence is if we actually remove the heart, and you could see the wall behind the heart where the great vessels come into the heart. So the great vessels, they stick out of the pericardium kind of like a bouquet of flowers spiraling out. And when you remove the heart, what you can see, can you see these, Mike? Let me make that a little
Yes.
bit bigger.
Yep.
You can see that between the great vessels, there are these little canals, this little bilayer of fascia,
Yes.
right? And that is the only place where fluid can escape from, where the extracellular fluid can escape from your heart.
Mm.
Nobody ever pointed this out to us in, let me cancel that. Nobody ever pointed this out to us when or at least not to me. I don't remember. Maybe I don't know, had gone to the bathroom. I don't know. But I don't remember anybody ever pointing this out, that is the only way, only healthy way that fluid can escape from your heart.
Mm.
If the fluid somehow moves through the wall of the pericardium, that's pathology. That's a pericardial effusion, right? We don't want that, right? And that can happen if the pericardium becomes so congested with fluid, eventually it will push fluid through the wall, right? And that's a very pathological situation. You got to do something about that. Now, this is true with all of the organs. This is true with the lungs. This is true with the organs in the abdomen, that bilayer of fascia that opens up to the rest of the body is the only way that fluid can drain out of these different organ systems, right? And remember, everything congested with lymph is going to be stiff, right? So if there's so much congestion packed in around those great vessels and in the pericardium is not going to be able to move well. Or the heart's not going to be able to move well, and the pericardium's not going to be able to move well. Now, something very important in your question was, what's the relationship between the diaphragm and the movement of the heart? The outer pericardium is contiguous with the central tendon of the diaphragm. Hold on, I have to bring that back so that you can see that I do not lie here. So you can see it here. You see how this outer pericardium, oops, make smaller. Why isn't it making it smaller? Well, you can see here that outer pericardium is contiguous with the central tendon of the diaphragm. That means that when your diaphragm, make that big again, that means when your diaphragm goes down, it elongates the pericardium, and your heart should be free to spiral down towards the midline, right? And it will spiral because it migrated into the pericardium as a spiral. The vessels are lined up to spiral, and nature loves a spiral. Actually, that's the first thing. Nature loves a spiral, and thus it migrated in a spiral. And thus the great vessels have it primed to spiral as it moves, if it has healthy motion. So when the diaphragm descends, elongating the pericardium, your heart should spiral within the pericardium. Now, as anybody who has done any kind of grappling, you know that the easiest way out of a bad situation is always to spiral, because nature loves a spiral and it gives you maximum power and efficiency. So if the heart is congested, if the pericardium is congested because the fluid's not moving back there, and we should discuss why the fluid's not moving back there, but we can get to that, then it's not going to be free to move. And it's not going to get what I think is probably the most powerful input on cardiac output. The most powerful influence on cardiac output should be that spiraling, slingshotting motion that is generated by inhalation and exhalation.
Yeah.
That is driven by your thoracic diaphragm. So that's part of heart health. The next piece, like down the line of disease and or dysfunction and disease, is that if it's congested, now it's immunocompromised, and it's or has or immunological imbalance. Sometimes that's just the overaccumulation of wayward inflammation, right? Because it's not, the inflammation's not moving out of there. Your immune mediators aren't moving out of there, right? Everything's just sitting there inside the bag, and the bag with the heart, like soaking, in this stew of waste product and wayward immune mediators. That's just not gonna, that's a pathway to disease, right? You're gonna lose vitality, you're gonna lose immune function, you're gonna lose autonomic regulation, you're gonna become stiff, and it's painful. You may not feel the pain as your heart pain. It will usually feel like upper back pain, I think, is my impression. It usually feels like upper back pain. And did I answer that question? What was the rest of that question? It
Well, I'm
was,
just curious. I guess where I was curious with this was, you mentioned earlier on that the diaphragm's responsible for a huge percentage of the circulation, and so my brain immediately went to the fact that, oh, okay, so if the diaphragm's not moving in a way that we would need it to, does that then put more stress on the heart to pump more, and therefore do some sort of damage or age-related decline, speed up to the heart?
sure, and things like where the heart becomes what they call hypertrophic, where the muscle of the heart gets larger and larger, which actually and the heart becomes stiff, and so it doesn't pump as well. That's the pathway toward like on the whole heart disease spectrum, including infarction, including congestive heart failure. Yes, it puts too much, and probably one of the best things that we can do, especially for someone with congestive heart failure, is teach people how to breathe well, because that is what will clear the fluid from the pericardium. It
Incredible.
is congested heart failure,
Wow. Wow.
congestive heart failure.
That's
And
insane.
so, yes, so I think that answers your question probably
Yes,
pretty good for right now. Oh,
for sure.
actually, it can actually lead us right into this other very important piece. So before we go into it, I would love to ask the people who are listening to this to please take some breaths. Sit up straight. You can close your eyes if you want to, unless you're driving. Don't do that. But try to sit up straight and take some of the best breaths you can. Try to really get what feels like a good, satisfying breath to you. And as you do this, sitting up straight, I want you to notice where you feel most of the sensation in your body. Now, breathing produces changing sensations in the body. Inhalation, the sensations of contraction, feels different from exhalation, the sensations of relaxation. Where do you feel most of those sensations happening? Now, Mike, you've done this before, so you can't cheat. But most of us are going to feel most, if not all of the sensation of breathing, kind of right here, on the front of your body, at the bottom of your rib cage, and the top of your abdomen, right? Probably most of the sensation here. Some of you may feel some or even most of the sensation up here in the chest or shoulders or neck. And then there are also people who might feel some on the sides or even a little on the back. But the truth is right here, and this is so important, like this little bit of information could change the world. I really believe that to be true. Most of your diaphragm is on the back half of your body. What we would call the posterior portion of the diaphragm is the vast majority of diaphragm. And I will show you a really great picture. Hold on. Which one is it? Window. There we go. Okay, so here's a picture of the diaphragm from the front. And can you see my screen share?
Yes.
And you see that there are these two little slips of muscle on the front of the body. And then you can see, it's kind of like an open stage curtain. And the back wall of the diaphragm is like the backdrop. It's a solid wall of muscle, right? So this picture will shows you that it's probably 2/3 to 3/4 of the diaphragm is on the back half of your body. And let me point out while we're here, look how the size of the heart compared to the stroke volume of the diaphragm. How many hearts could you fit underneath the diaphragm, much less the little chambers of the heart? It really shows you how powerful the thoracic diaphragm is. And if you think about this just on your own body, you can see your diaphragm comes down to here on the front, and it comes almost all the way down to here on the back of your body. There's no muscle fibers in this little triangle, right? This is all muscle back here. So if you're not feeling robust, and usually what I do in when I have people live with me is I have them put their hand on my back so they can see what it feels like when I breathe. It's amazing. Feels like I almost have a mouth on the back of my body, like pulling in all of the pressure change I need. But if you're not feeling robust sensation on the back of your body as you inhale and exhale, you're probably only, and this is all estimates, somebody is going to help me do the research out there to show this, but you're probably only using about 10 to 25% of your thoracic diaphragm's capacity, because this is probably 2/3 to 3/4 of the muscle is back here. And if you, and that, as we all know, because we're all still here, is giving us plenty of oxygen and balancing our carbon dioxide. But what it won't give you, what a little shallow breath won't give you, is good fluid motion. And good fluid motion is good physiology. Better fluid motion is better physiology. It's less stiffness and pain. It's better vitality, immune function, metabolism, autonomic regulation, and a whole bunch of other things that hopefully we'll get a chance to talk about. And there's two other things I should say about this. The first one, just to finish off things with heart health, is that there's a reason most of the diaphragm is on the back wall of the body. And that's because every organ system in your body, with the single exception that I can think of, being the skin, right, which is a very large exception. The skin is the large organ. But every other organ that I can think of drains its extracellular fluid to the back wall of the body, or it's on the back wall of the body. So that is actually where we need the most compression and release. That's where we need the biggest pumping action. And sadly, almost nobody is getting it. Almost nobody is accessing that motion on the back of the body. I love this question. You asked the best questions. So I have a little thing here so I can show you. So let's do this all together, everybody. I want you to slouch with me. Go ahead and slouch. You know you want to. It's so much more comfortable, right? So much more comfortable for us to slouch. Now, while you're slouching, enjoying a little break from being good, what I want you to do is I want you to notice, bring your awareness to your sit bones and notice that you are on the back slope of your sit bones. Now what I want you to do is, and notice while you're here that you can feel a little bit of movement on the back of your body as you inhale and exhale. Even if you're not trying to get a big breath, you can feel a little motion. Can you feel that motion back there? All right, so now what I want you to do is I want you to I want you to sit up straight. Go ahead and sit up as straight as you can. You can pull your shoulders back. And I want you to take some breaths now. And I want you to notice how awful it is to breathe with the military posture, what we think of as sitting up straight, right? It pushes all the breath to the front of the body when you sit up straight. And we are now on the front of the sit bones. So now what I want you to do is go back to slouching. And now we're starting with slouching where we can have a little bit of a breath. Now roll forward on your sit bones till you find the transition point between the front and the back of the sit bones, where you're not on the front and you're not on the back. Now, what I want you to do, and I have this here, you can, if you have a belt or something, you can put it around the back border of your diaphragm. And now from here, what I want you to do is quite a push. I'm sorry, I should have mentioned this earlier, to have one of these things handy. Maybe we can add that at the beginning. Have some type of strap or elastic or something and put it around the back of your body, right? And you don't have to pull on it hard, but use it as a little bit of sensory feedback. And now that you feel where that muscle is, that muscle you haven't been using, on the transition point, and if that means you're a little slouched in the upper back, that's okay right now. Leave as much slouch there as you need to be able to push the strap off the back of your body with your breath. Were you able to feel more sensation across the back of your body when you did
Yeah,
that?
I'm just pulling my jumper to feel it. What I'm thinking would be amazing, because this is more of a conversational podcast, Anjani, if you'd be willing to come back and do like a presentation for us separate to this, where we could maybe guide people through some of these
Oh,
exercises.
100%.
That would be ace. That would be really ace,
I think
to
you would
do that.
probably need
Yeah.
more than one to go through what I've
Yeah.
learned.
No, I'd love to. I'd
So,
love to do that. So I think, yeah, if you don't mind, like I think what might, because people will be listening to this and watching this while they're doing things, we could maybe set up an entirely separate class where you come back and it would be an honor for you to guide us through some of this stuff, and we can get the props you
sure,
need. And yeah,
sure.
okay,
And honestly, you know, like the bottom line is you have so much skeletal muscle on the back of your body that if you are hyperextended, will not function. It's
interesting.
simply inactivated. It's just like if you cut the strings on a parachute, right? You inactivate part of that diaphragm. It's no longer going to function the way you want it to function, right? So having that hyperextension of the lumbar spine that results from people trying to be upright when they're really like this, is what makes it so that most people are not able to use the back of their diaphragm. And that's almost everybody. If you go somewhere in this little town and find somebody who's breathing with the back of the diaphragm, 99% they're my patient. It's really very rare. I think I've only stumbled on a couple of people and the hundreds and probably thousands of backs that I've palpated at this point who were breathing with the back of their diaphragm at all. And even then, they were not utilizing the natural, amazing, magical capacities of diaphragms to maximize that recruitment on the back of the diaphragm, and therefore maximize fluid return and physiological greatness.
So if people are watching this right now and they're thinking, "Oh, what can I do right now, if after this podcast to start to use my diaphragm in its entirety?" What could you give us just a couple of things as suggestions, and what would be the biggest benefits if they started to use the back of their diaphragms more?
Well, I think probably, what we just talked about, feeling the back, because this transition point between the front and the back of the sit bones is so important. The other place where you can find this more readily is if you're lying down on the ground with your legs over a bolster, right? That will help you be able to have your back lay flat on the floor. So you will have the right relationship between your pelvis and your lumbar spine to generate motion on the back of your diaphragm. If you are, it's much harder to do when you're first learning doing it standing up. This is why in traditional martial arts, they have us do so much stance work, because you develop that relationship with the pelvis and the lumbar spine that allows you to breathe well, if you get good instruction. So finding that transition point between the front and the back of the sit bones while you're seated, and for those of you who have to sit at a desk a lot, I'm sorry, first of all, but while you're there, you might as well be sitting in a way that, first of all, is more comfortable, right? Because it gives you you're not having to work so hard. If you're just thinking, I need to be on the transition point, I'll extend through the upper back and neck as much as I can comfortably without compromising here. And so you'll be more comfortable, and gradually you will remove the congestion back here that the residual pressure is what is pushing you forward. The residual fluid pressure in those tissues is what's pushing you forward. But you're never going to be able to remove that. You're never going to be able to remove that without being in a constant battle to be upright, unless you clear the congestion and start using the back of the diaphragm. It's amazing, honestly. I can put my hands on somebody who those big cables people have on the back of their body that's like ropes. You have that? And when they activate, and it feels hard like a bone sometimes, right? And put your hands on that, and they start breathing with the back of their diaphragm, and it softens immediately because you're sucking the fluid out of the tissues that's making it stiff and painful, right? Because healthy tissue is soft, it's supple, and it's mobile, right? Diseased and dysfunctional tissue is hard and restricted. So clearing the fluid from the tissues is what is going to create the softness and the suppleness. And then other things. So practicing at first while you're seated or lying down, I think, is best. Now, and I'll explain why. It's because you develop residual fluid pressure wherever it is that you're not breathing well, right? And that might push your head to the side. It might push you this way. It might hike one hip up higher than the other. But you're going to develop residual fluid pressure wherever you're not breathing well and wherever you're not generating vortices. So for most people, what happens is the back of their hip socket, where the thigh bone goes into the hip socket, the back portion of that socket gets congested with fluid. And so you can't really get good extension at that joint because, and I guess I'll unpack that more in a minute. So because there's so much congestion back there, it tilts. When people stand up from this better posture, when they come up, the pelvis tilts forward and they go into hyperextension when they're standing. And in order to clear that, you have to relax the hip socket so that your back can have a good relationship with the pelvis again. And I guess, and you know, how many more minutes do we have here?
I think we can run for at least another 10.
Okay. Can
Yeah.
I just mention, because we're talking about, you're like, well, how am I going to clear congestion out of the back of my acetabulum? Was that your question?
I don't know what an acetabulum is, but
Oh,
how do
the
I clear congestion is my
acetabulum is
question.
the hip socket. Thank you for pointing that out.
Okay. Yeah.
How do I clear congestion out of the back of my hip socket? And this gets very exciting now because once you are able to recruit the entire thoracic diaphragm, and I'm sure that there's far more for me to learn about how to get better recruitment of the thoracic diaphragm. And it might just be someone out there listening to this who teaches that to me. Because there's this area very ripe for discovery. There's so much that people can learn for themselves. It's everybody's discovery to have. But once we're able to get that full, complete recruitment of the thoracic diaphragm, then your body will start to expand spherically in all directions. Kind of like that, the physiotherapist who was talking about the 3D breath, right? It's a 3D breath, but if you start the breath in one place, you can take advantage of the natural capacity of a diaphragm to host a wave, like little kids making a wave in a parachute. Once you start it in one place, that wave will then be able to recruit the whole thoracic diaphragm. When you do that and you get that 3D breath, now you can go on to recruit the other diaphragms in the body. There are more than 74 diaphragms in the body that I have recognized. Sheets attached to frames. They're all sheets. We start with the pelvic floor, is the pelvic diaphragm. And if we allow this wave of contraction to emanate spherically from the thoracic diaphragm, we can start to recruit these other diaphragms, because another magical capacity of diaphragms is the capacity to host, to integrate. Diaphragms like to integrate, like a geodesic dome. Our body can kind of be like this geodesic dome of multiple diaphragms, at least 74 of them. It may be more than that that I've recognized, but there's at least 74 now. And all of these diaphragms can participate in moving air and fluid in the body. All of them can breathe. You have more than 25 of them in your head alone. And each of these diaphragms in the body is responsible for fluid motion of a specific region of the body, right? So the different diaphragms in my head will change the pressure in different parts of my brain. I know, I just said that. It's very exciting, right? And you will actually feel a change in pressure in the head as you allow these diaphragms to come online. Most of it is allowing and surrender, not go-getting. And when you allow them to come online, you will not only feel pressure change, but you will often feel a distinct change in the pressure and the temperature inside your head. Which is very exciting. Is it Mark Allen, Dr. Mark Allen, who did the concussion doctor? He was talking about like cooling the brain off. You have literally cooling pumps in your head for getting that old lymphatic fluid out of the tissues and restoring a good environment for your physiology. There's a diaphragm that stabilizes and governs every major joint complex in the body. And there's also a diaphragm that, at least one, that stabilizes, governs, and animates every major autonomic hub. So when all of these diaphragms are being uh, are being coordinated, integrated by your thoracic diaphragm, which is like Dr. Courtney was talking about how it's like a conductor of a symphony. This is the conductor of the symphony. And I just really love her work. I just want to say that right now. I just love her work. If this diaphragm is conducting the whole symphony, now, now you're going to have integrated, coherent, fluid motion of all of these diaphragms. And you've been so kind to just let me ramble on here. I have one more thing I want to throw out there, and that's that diaphragms are extraordinary structures. If you contemplate the many diaphragms we have in the external environment, the parachute, the sail, the kite, the drumhead, the trampoline, the spider web, the sheathing that we put on a building to integrate it, the subfloor, the spider web, love the spider web, and even the surface tension on a body of water is actually the reason that it ripples. It's because it is a sheet of increased hydrogen bonding on the surface of the water. So the water molecules stick together more on the surface of the water and create a sheet. That's why if you fill the glass to the top, you'll have a little bubble on the top because that sheet is a diaphragm that's holding it in. The water strider can walk on the water because it's on a diaphragm. It's just so cool. But that's actually why it ripples. So if you think about all these diaphragms we see in the external environment, you see that they have extraordinary capacities, extraordinary. That's why we use them as humans or animals to achieve certain ends. And the crazy beautiful thing about our diaphragms is that they almost all have a muscular component. I would say they all have a muscular component to them. Some of them, are just muscle, right? Most of them are muscle itself, but there's some diaphragms that have a muscular component, like the eardrum, for example. There's a muscle, but it's more connective tissue than it is muscle. But they all have a muscular component. The reason that diaphragms in the external environment have their various interesting capacities is a result of the amount of tension that is in the sheet and the rigidity and nature of the frame to which it's attached. Our diaphragms are mostly muscular, and that means we can change the tension in the sheet at will. And that means that we can make it and we can change the shape of the frame. So we can make it act like any diaphragm in the external environment. So we have all of these extraordinary capacities of pressure change, hosting wave, integration, dispersing impact. We have that in every diaphragm of the body. And there's more that than I have time to mention.
It's been an absolute pleasure. I really would love to invite you back to do more. If you can just give us the what do they call it, TLDR here. So if somebody wants to reduce that stiffness and help move that lymph and get their diaphragm to have full range of movement, give us a couple of tips what people can do directly after this show to start to regain some of that function. What would you recommend they do next?
I would say, first of all, when you're trying to do that, you might want to start either seated or lying on your back to be able to get a good relationship, to really be able to study that relationship between the pelvis and the lumbar spine. If you're standing, you might want to be more like the tennis stance kind of thing, where you're kind of like, or like you're on a horse, so that your low back is long, because that will help you to be able to get the motion on the back of your body, so that you get that spherical expansion. Now, I think that probably, and you can watch. I have a very glossy YouTube channel, not really glossy at all, um, but I have a level 1 breathing video that will show you how to use the. It'll teach you how to find the back of the thoracic diaphragm. It'll teach you how to breathe with, I think at least like 24 diaphragms in that video. It's from a few years ago. And I just keep learning more. And then there's another video that will speak directly to what you're asking about, which is called Superpowers, an introduction to the body's hydraulic system. And so that is what I would have people refer to there, because let me see if I can make a haiku out of this. So when I expand, if I expand myself, if I find that transition point between the front and the back of my sit bones, and I put my tongue on the roof of my mouth and swallow and make that little suction seal, and then practice breathing with the back of my body, my whole body will expand cylindrically or spherically. And so, and there's 3 diaphragms in each of these extremities. So if I inhale and I relax everything, what I'm doing is I'm flexing the toes, flexing the ankles, squeezing all the muscles of my body, because every muscle in the body participates in at least one diaphragmatic complex. Every single one. So if I engage them all with an inhalation, you really feel your whole body expand, right? And you'll really feel the whole thing collapse. You'll actually feel your extremities spiraling out of your body, each bone spiraling out from the one before it. And you can actually try this. You can switch sides. So if I inhale and squeeze all the muscles on one side, I will fill up one side of the body when I inhale, and it will collapse when I exhale. And then I can switch to the other side and fill up the other side of the body. Once you are able to do this, and it's really not hard. In fact, by the end of the level 1 breath class, you'll be able to very easily be able to do a bunch of things very easily. You'll be able to slow your respiratory rate down to easily less than 6 breaths per second, right? Probably more like 3 breaths per second. But it will be comfortable. There will be no air hunger. There'll be no misery attached. It'll just be lovely. And you'll be able to switch sides. You'll be able to choose which side of the diaphragm, or which hemisphere, which is the right or the left. And you'll be able to see, wow, I can fill up my whole right side of my body without having that same action on the left, and I can drain the whole thing as well. You know, I would say do the level 1 breath class, find those diaphragms, because I think it's going to be kind of a complicated thing for me to get into. But once you start to be able to have that kind of conscious competence, and again, you'll be doing it at the end of I think it's 1 hour and 15 minutes or something like that video. You'll be able to do all of that easily by the end. If you have questions, let me know. And then you can start to use the hydraulic system. Then I can make a choice to pressurize the right side, and then I can relax the right side of my body. And then I can, when I want to, and I can use that vortex that I'm generating on this side to create the motion. And then I'll inhale on this side to push my head further and to bring me back. Could you see that, what I'm talking about there? It's even more dramatic with side bending. Let me show you. I'll drain. this side of my body. I'm relaxing every muscle in this side of my body all the way down to my feet. And when I'm all the way empty, I'll inhale on this side. And I use the pressure to push me into the end range of motion and come back. Let me show you what that looks like if I just yank my head side to side, which is what most of us do most of the time. It's very different, right? You can see like all kinds of weird things going on there. And that's because if you try to fold up a part of the body without releasing the pressure there first, it's like having a golf ball and a door hinge, right? So right now your body is full of golf balls in all of your door hinges. And it's even more important that there's congestion in the organ systems, right? And maybe that would be the thing that is probably the most helpful for people first starting to do this. When you're trying to open your body up, don't think about fighting your muscles to open up. Think about getting the congestion out of your organ systems, because that is the primary cause of stiffness in the torso and even in other parts of the body. It's because if there's so much congestion in your organs, your muscles will literally not allow you to do things that will jeopardize your organ systems. Your muscles are not like, they don't just spasm, you know? They don't. They're very intelligent. They're very adaptable. They get inside information from your autonomic nervous system, and they are selfless servants of your viscera, your organs, your arteries, your veins, nerves. They will do whatever they need to do to protect your organ systems and even your joint complexes, right? So if I'm trying to yank myself into a forward bend, right, but I haven't released the pressure from the front of the body, my hamstrings are going to be tight because they are serving me. Muscles are such great guys, right? They're such great guys. They will stay tight as long as they need to. The muscles on your torso will tighten even if the body just detects that there's extracellular fluid congestion in the organs. The muscles will stay tight to try to drain that fluid from the organ. And if you try to put your body in a position it doesn't want to go, the muscle just stops you. So I would say, as you're moving, try to get your organ systems. Think about trying to move the fluid in your organ systems. That means using the back wall of your diaphragm. And as you're doing things, don't push yourself to get your head closer to your feet. Think about relaxing the front of your body and letting the fluid move.
Sure.
Right? Or turning as far as you can and then inhale to go further and come back.
Yeah.
In your pain-free range of motion. And as you do that, you pump the fluid out. You make the tissues more supple, and you will be happier.
Anjani, a pleasure having you on. Thank you so much for your time. We'll
Thank
link
you so much, Mike.
everybody's links down below. And yeah, we would love to do something in the future with you, maybe where you come back and teach us a little more. So thank you so much, everybody. Thank you for watching.
so
Anjani's links are all down below, so you can get to her YouTube channel, her website, all that good stuff. Please encourage you to go and check it all out and leave us a comment down below and let us know if you can feel the back of your diaphragm and what's going on there. Anjani, thank you again. Speak to you soon.
Thank you. Have a great day, Mike. I appreciate it so much.
Appreciate you. Cheers. Hey, thank you so much for sticking all the way through to the end of the podcast. I mean this so much. It means the world to me that you would watch this podcast, engage with it, and stick all the way through. So genuine thank you. You're the reason that we do these interviews. I love speaking to all these people and sharing this amazing info. And I hope you got something from it. If something did stand out for you, then please put a comment on the YouTube video, because it'll help embed it for you, but it'll also give somebody else something that they can take away as well. And just while you're here, just a reminder that if you're exhausted, you've got any form of burnout, or you feel like you might be heading towards burnout, you've got some stress and anxiety, our 7-day burnout reset program is free for a limited time. And the only caveat I have, the only thing I'd say is, if you're going to do it, just do it. Don't delay. Don't get it and then think I'll do it next month. Just do it. It's only 7 minutes a day, and I promise you, you'll feel different after 7 days. Each day I'm going to give you a different exercise to do. It's only a couple of minutes. At the end of the week, you will have felt all these different exercises that I've picked. I've chosen these amazing exercises, and you'll feel more relaxed, you'll feel calm, you'll hopefully sleep a little better, and you'll learn a few extra things about the breath as well. So the link's down below. We're normally charging nearly $100 for this. We're giving it away, just giving it away for free. So grab it while it is free, and I cannot wait to hear how you get on. If you're looking for something to do after this podcast, I would say get the course. I was going to give you a video to watch or something like that. Don't do that. Get the course, and I look forward to reading your comments below. All right, have a beautiful day, and just know that whatever state you're in right now, whatever led you to this podcast or this channel, know that there is hope out there, and that millions of people have shifted their lives, their mental health and their physical health, and you too can do the same thing. And I believe in you and I trust you. All right, take care. I'll speak to you soon. Cheers.